It is time for another Y107 MU Healthcare Ask the Expert podcast, and our expert this time joining us is MU Healthcare otolaryngologist, Dr. Mark Gilbert, explaining how he and his team can help you if you are having some vocal or voice issues or swallowing problems. Explain what are some of the most common vocal issues and problems that people have that need to come see a doctor.
Well, usually a voice problem is either that the voice itself is different than normal, and normal is different for everybody. You know, your voice is your voice, but if I had your voice, I might say, okay, I'm pretty hoarse. But if you had my voice, you might say, I'm pretty hoarse. So any change in your voice from what you perceive to be normal, or what maybe someone else asks you or tells you is normal, or any difficulty with using your voice. So that can be pain with voice use. That can be fatigue. Certainly can be instability in the voice, where the voice is not the same, maybe even during phrases or during the day. Any of those things are what we would call voice problems.
How common are swallowing issues, and how can you treat patients that are struggling with an issue like this?
Swallowing difficulty is fairly common. About 1 in 25 adults a year complain of some sort of swallowing issue. That goes up as we get a bit older. There certainly can be some difficulty swallowing as our body ages, as muscles kind of lose their tone. And just, maybe we're not thinking as well. We get into our 80s and 90s. Sometimes dementia can cause some of that. But then again, there are a number of swallowing issues that can be managed with things like therapy, occasionally surgery. We have a team where we can evaluate your swallowing and determine kind of what's going on and what the best treatment is.
Reach out to find out if this is an issue. If you're sitting there in the car on the way to work this morning going, yeah, I need to make a phone call. Trust the team at MU Healthcare for simple and complex voice, airway, swallowing issues and problems. Get that appointment scheduled today, 573-884-2200 or muhealth.org. Why MU Healthcare? Why choose you, Doc, and the team that they have there at MU Health to help with any of these vocal issues?
Well, for myself particularly, I'm one of about a couple hundred people in the United States who have trained specifically in voice, airway, and swallowing disorders, having spent an extra year in what we call laryngology and care of the professional voice. I'm particularly experienced at seeing pretty rare voice problems. And we have a team that manages these. I have a speech-language pathologist in our practice who treats voice disorders specifically. So that's pretty rare for speech pathologists. Most do not know how to treat voice disorders. And she also did training in what's called vocology, which is basically the science of how the voice works.
And you've worked with singers in Nashville and from actors, like you said earlier, to...
In my training, we saw some of the most famous people, in the world, people who... If I say their first name, you know who they are. and that's, uncommon to see those kind of people. But that experience gives me a fair amount of comfort in managing very high-end voice users.
For those who have listened to me on the air for a long time, they've kind of followed me along with my vocal cord journey over the years with hoarseness and weakness, different things, and the surgery 7-8 years ago. What message do you have to me or anyone else who may be struggling or has the same kind of issues over the years that I've struggled with?
Well, I would say that certainly you may not be aware that there are always things we can do to help your voice get better. Sometimes people think, okay, this is my voice, this is going to be who I'm going to be, and that is actually not always the case. Sometimes you've been underdiagnosed, sometimes you've been misdiagnosed, sometimes no one's taken a look. And we have a variety of therapies, sometimes surgery, that can help with voice issues. So even if you've had an unusual voice for yourself for a long period of time, there are often treatments that will make it better.
Dr. Gilbert is here, and I think a lot of people that have swallowing issues or vocal issues, they think, well, I got to go to St. Louis or Kansas City. Or no, right here in Mizzou and, at the university. You're here with all your training and so many other members of your team that can help folks right here in Mid-Mo to take care of some really complex potential issues.
Yeah, for our clinic, there's really nothing that you can get at another institution that we don't do here. We kind of treat them. I mean, there's some very rare things that occur elsewhere at very large institutions, but we treat the full range of voice, airway, and swallowing disorders. And we've done complex airway reconstruction. We've done, small vocal fold lesions. We've seen high-end professional voice users. We've done swallowing surgery frequently. So there's nothing we don't do, and there's no reason to drive 2-3 hours when you can drive, just a few minutes and be right here at MU.
Absolutely. Get that appointment set up, muhealth.org, or call 573-884-2200. Doc, thank you so much for your time. I will be in touch very soon because we could talk on the air for this whole show, and that's not what people want to hear, but I will definitely be in touch to continue to work on. Not that I feel there's anything wrong with my voice, but I want to continue to make sure it's better, that I can keep doing what I get to do every day and make it safe.
We'll be happy to take care of you.
Thank you.